Hello, this is Dr. Latasha McElwain. I am here today to present overview of autism, understanding coaching, advocating, and building the awareness of autism. So this is going to be a video for supervision purposes, and this is just to give more of an overview of autism and to talk about understanding what coaching families and individuals with autism would look like, advocating for the family and those individuals with autism, and then also building the awareness around autism so that people know and people are aware of different, I guess, intricate nuances of dealing with an individual with autism so that people could be more aware. So, want to go right into talking about autism coaching, advocate, and awareness. So, one of the reasons why we did come forth with this video for the purpose of supervision is because we do have a program with our Green McElwain Foundation where we are trying to definitely build that awareness. We are building in to have coaching for individuals, have advocacy for individuals, as well as anything that's going to be able to support individuals with autism, and wanting to make sure that we are also adding a little bit more to that. We'll also be doing some coaching and some advocacy and awareness around individuals with special needs, as well as individuals that are struggling with, when it comes down to substance abuse issues. We're looking at branching into coaching, advocacy, prevention, and awareness when it comes down to substance use concerns and issues. So we're definitely looking to move in that direction of understanding what coaching is, advocating this, and awareness. We also have another program that is that we're looking at, and that one is actually working with young teen moms that end up in that scenario, and we are able to coach, advocate, and also definitely be as a service to those individuals as well. So with all the services that we provide, we are looking to make sure that we are giving individuals a good, wholesome service with coaching, advocacy, awareness, prevention, all those things wrapped into one. Education. We really just want to make people aware and how they can be able to assist themselves, or they can get the assistance from someone else that help them to be able to assist themselves. So moving along from there, autism coaching, advocate, and awareness. So I went ahead and I just dropped down and did the definition for all of them so we can just talk about it a little bit. Autism, ASD, autism spectrum disorder. Basically, it's a neurological and developmental disorder that typically affects how people may interact with others in their communication and how they may learn or how they may behave, definitely behaving in certain settings. So a lot of times we're looking at ASD. It is a developmental disability that can affect people's social communication and behavior development. So with that being said, a lot of times we understand that if a child is affected with ASD, we do have to keep in mind that everyone's affected differently. There is no two persons with autism that might respond the same way or totally different. I mean, it could happen where they respond totally different to things. So for the most part, we have to remember that everyone is unique. Everyone has strengths, everyone has challenges, and everyone have different needs. So all these are just helping people understand what autism is for the most part here. Next part here, we're looking at coaching. So coaching is a form of developmental in which a experienced person that experienced person would be able to support and be like basically the other person is learning from them, and that person would be able to achieve whatever specific personal goals or personal professional goals that they may have, and this is going to be provided through training and guidance. So when we're talking about coaching, we're definitely looking at the experienced person being able to support the learner in the way that they're able to get what they need and kind of move to the next level themselves. When we're talking about advocate, an advocate is one person who supports and promotes the interests of a cause or a group. So one who defends or maintain a cause or proposal. So with that being said, when we're talking about advocates, we're talking about individuals that really want to support, wanting to maintain, wanting to promote that the awareness of that group and everything else, everything about that particular group or that cause. And then we move down to the word awareness, because I just used it just now. When we're looking at awareness, awareness comes along with having the knowledge and the perception of the situation, or being able to convey that knowledge and perception to get the awareness out there. For the most part, when we're looking at autism, we're looking at, or any area for the most part, when we're talking about giving someone the knowledge, giving someone the awareness that they need to have to be, work in that area for the most part. That means that that person becomes well informed. They're very interested in what's going on, the particular situations and the development of things. They are definitely in there and they know. So they have facts that can back up their knowledge base. So for the most part, when we're talking about awareness, um, advocate, coaching, and autism in this setting, we're talking about basically being able to make people aware of what's going on, so that there are individuals out there that could be a guide for others, as well as individuals that can be a person that will support and promote the what's going on, the main cause of what's going on, or the proposal, defended the proposal, or it's an individual that's kind of out there with that awareness piece, which is really having the knowledge, having the specific facts, and knowing about the concerns and able to get that out there, because they're informed, they have an informed interest in the particular situation. Okay, so we're going to move right along and talk about some of the overview and facts. So we're talking about autism. So autism coaching and autism advocates is kind of a real thing, but not necessarily a real thing. But basically, they're essentially experts in the area that will guide with living, a person living with autism, a person that's living in the autism world. Basically, they are the experts and the guys that help an individual to kind of navigate different areas. Because the autism world is so, there's so many diverse parts and it's so complex, that basically a lot of times there are individuals, um, basically they need to have many different specialties, or you may find several different individuals with many different specialties. So you may have someone that might have more experience in the legal aspect of things, maybe an attorney. You might have someone that has a little bit more experience in the housing aspect of things, maybe a case manager. You may have someone that have more of expertise in the educational piece of things. So that bring another piece as well. And we're talking about the different specialties. Um, of course, when we're talking about autism, we have to look at that, about 4 times more likely that we have boys that will be diagnosed with autism than girls. We also have to look at the fact that children that end up with autism, um, there's it's all races, all ethnicities, all ethnic backgrounds, all socioeconomic groups. Everyone can be affected. Also, when we're talking about autism, we have to be mindful that every child with ASD has different skills, challenges, and needs. So they have their own special thing that they kind of deal with for the most part. I have never really seen a whole bunch of children dealing with autism that were just the same. All children are different when it comes down to autism. I believe, from being a parent of a child with autism, that the more you expose a child to, I did a lot of exposure therapy with my son. And with a lot of that exposure therapy, he's able to do a magnitude of things that, don't get me wrong, in my professional career, I have met families where the child can't go to Carowinds, or the child can't go to Disney World, or the child can't go to a football game and things like that. But basketball game, or but my son, he does all that. He goes to football games, basketball games, Disney World, Carowinds, yeah, you name it. It's a sporting event. He's there. He's not afraid of being large crowds with a whole lot of people. Now, mommy, on the other hand, I get a little nervous, but he's definitely, there's no fear there with going to those type of events with all that noise. No, he's totally fine. So I say that to say everyone's going to have different skills, different challenges, and different needs. Okay. All right. Then when we're talking about ASD, basically you can pretty much get a reliable diagnosis around age 2 or age 3. But of course, when we're talking about diagnosing, we definitely want to start looking at things as early as possible in order to get services that are needed in place. A little bit more about overview and facts. Basically, there's no cure for autism. So if a person is diagnosed with ASD, then there's no cure, but there are several interventions that can help a child learn important skills that improve their everyday life. Typically, the earlier a child is diagnosed and receives services, the better their outcomes are. So, children with ASD can learn and succeed in classroom and beyond, like every child, with the help of their family, providers, doctors, specialists, and communities. Kids with ASD can really thrive. So I really like that part of it. And these are just facts and overview of information of autism. So I want to move right along and talk about autism coaching and advocate credentials. So there is no credentialing board for, well, there's no meaningful credential that we are aware of that is available for autism coaching or advocating per se. But we do understand that there are just different areas that people can have specializations in, yeah, to help families through. They may have credentials or they may not have credentials. I've seen a lot of coaches and advocates that are doing coming from a counseling background, coming from social work background, special education, psychologists, therapists, even lawyers. So for the most part, with our program, we try to make sure that our advocates are coaches when we get to that point of having coaches. But right now, we just have a lot of advocates and navigators. Our advocates and navigators definitely have a counseling background or a social work background. They are moving in that direction and are pretty much in that field and definitely understanding and becoming the expert in what they do as well. However, myself, I have experience in educational backing, of course, in the counseling field, but I have lived experience because I have a son that has autism, then I have another son that has his special needs as well. So with that being said, it's a double, kind of scenario for me where I'm getting to be an expert on both sides, because I'll mention later on, and no, I'm going to mention it right now, that sometimes there are parents that become the experts because they are definitely experiencing that on a daily basis and able to assist other parents or other individuals with a child that's living in and they have their own things going on for the most part that is making their situation successful, and it might be helpful to other people. So that's what I like to think about sometimes when I think of being a parent, um and considering yourself an expert because you're a parent. I totally understand that. So I have seen a good bit of parents that have jumped into that and have kind of finessed that, and I've seen a whole set of parents who's also said, no, I'm not the expert, yeah, I'll let you handle everything. So from what I understand, no credentialing is required when we're talking about having someone as an autism coach, an autism advocate, or a person that's building the awareness for autism. But like I said, having some level of credentials on the other side that's not specifically autism is also a great way to go for individuals who want to get into this area and be able to help those individuals that have autism. Moving right along, we talk about autism awareness. So Autism Awareness Day, if anyone doesn't know, is April 2nd. I'm thinking about Christmas already. All right. So Autism Awareness Day is April 2nd of every year. It is World Autism Day. So basically, that's where we are building a lot of the autism awareness that goes on and that needs to happen. So a lot of times, early identification of ASD is important, of course, when we talked about getting families services, getting the parents and the family services that can be offered to them. And then also, ASD affects 1 out of 68 children in the US, and that's from the CDC in 2014. So that's the last um, information I was able to pull up regarding autism, um, the last documented research information I was able to pull up regarding autism. So, Autism Awareness Month is a month long observance. It's basically focused on raising awareness about autism, the autism spectrum disorder, and basically is basically to have so we can talk about how to support individuals. We can talk about the difficulties and the discriminations that come, that individuals end up facing, individuals that have autism end up facing. So we are trying to make people more aware of autism when we look at the Autism Awareness Month. We have the Awareness Day and we have the full Awareness Month. So 5 ways you can raise autism awareness. You can educate yourself. Awareness starts with each person taking responsibility for themselves. So, being aware of yourself, having more awareness of autism, attending local events, getting actively involved when it comes down to supporting autism awareness and activities in your area. You can end up being an advocate for autism, and then speaking up and speaking out about what's going on, and experiences you may have had, or things that kind of not doesn't set well with you, but want to definitely make sure people are aware. And then be a positive role model. So definitely be that supportive, positive person when it comes down to either dealing with someone with autism or even trying to have other people be aware of what autism is. All right, so moving right along here, we're going to talk about early intervention because that's one of the big parts of making sure that you are able to get services in place. So while the diagnosing and providing specific interventions for young children with ASD is a role of specialty, basically early childhood providers can play a role in actively. So basically, they play an active role in making sure that they're supporting the child with autism or any other developmental disability because they're able to get involved with get the school system involved. So the daycare center, I guess I'll break it down. The daycare center can get the school system involved by saying that we're having some struggles with this particular child or these individuals in this class or whatever. They'll have some individuals come over to the daycare center and they'll do some testing. Once they start doing some testing, then they're going to bring them out, also have the parents bring them out for maybe a round of testing also. And once that round of testing is taken care of, then they're going to go ahead and say, okay, we are seeing some things happening here and we do want you to get more services. So they're going to start talking with mom. I went through the experience of they came in-house to the daycare center, and then I took my son a few times out the house to the CMS schools here in Charlotte, and they were able to work through a good portion of testing with him that eventually wound up us going to have the full testing done at Teach. And once we went through Teach, then the diagnosis was there, and we were getting all those services in place. He was able to get speech therapy in his daycare center. He was able to get into the early intervention program with CMS. So he left daycare shortly after that and went into CMS where they had the the speech therapist coming in. I'm going to probably go back between physical and speech because I have a son getting speech therapy and a son getting physical therapy. But my son is getting the speech therapy with the autism. They came in and they tested for all the other stuff too. They tested for occupational therapy. They tested for physical therapy to see if he needed those services in place also, which he didn't. So moving right along, we definitely was able to catch things early, and early intervention is what they're saying is the best way to ensure that individuals are going to get the services they need to live a more healthier and lifestyle as they get older for the most part, because they learn and they develop in different ways, but they're learning a whole lot of different things when they have a whole lot of good services in place. By using developmental appropriate practice, basically they track the developmental milestones, basically communicating with the parents. They're always being aware of community-based resources, early care and education providers They contribute a lot to, you know, young child's life and to the family's life, because they're sometimes are the ones who first end up seeing what's happening, what's going on. And that's kind of what happened in my scenario. So I tell people it is good to check on, have your kids checked out and make sure everything's, going well as needed when it comes down to their different milestones and things like that in a developmental track. All right. Also, let's talk about more about early intervention. So, step by step description of how to work with simple concepts in everyday routines. And these concepts include engaging a child in play, using children's interests in activities, promoting child participation with with a shared agenda, and then using visual cues to make choices, and then playing together with objects, and practicing joint attention. So these are things that the daycare center typically would work with a child. And if you're a parent, you can definitely do some of these things as well, I'm sure. Other things to think about when we talk about early intervention: learning words, doing joint attention, and that's probably in a group setting, I'm guessing. Book sharing, uncovering learning potentials, peer mediation support, teaching children to play with each other. Yeah, predictable spaces and predictable routines. Um, and then we're looking at distracting and redirecting children to engage in appropriate behavior. And a lot of these tips were developed, to help children with autism or ASD, so they will be able to help them, learn and grow for the most part. I will mention that everything there sounds pretty accurate, because I can definitely state and give to this research that yes, routine is big. Routine is one of those big things that we work on, and we make sure that everyone kind of knows what's happening next and what's going on and what's happening for the next week. So if we have a busy week, everyone knows we have a busy week, and we have a lot of things to get done. So all right. What services are available to young children with ASD under the Individual with Disability Education Act? So the A, I call it the A, excuse me, the IDEA, Individual with Disabilities Education Act, is a federal law that requires all children suspected of having a disability to be evaluated without cost to the families to determine if they have a disability, and they're eligible to be serviced under the IDEA Act. My whole thing is I agree with this 100%. It's just making sure that everyone is, on the same page when it comes down to a child having a disability. For children under 3 years of age, these services are provided through the state IDA um, Part C, the early intervention system. And for children older than 3, then it's under Part B, services that are through the public school. So they have the 3-year-old program that once they have turned 3, they can go actually into the early intervention program. So that's usually a good way of going as well. When we're talking about awareness, um, it builds the acceptance. So awareness builds the acceptance. And according to Claire Delano here, we got some information there where she stated that enhanced self-esteem, acceptance empowers people with autism to embrace their uniqueness, which boosts their self-esteem and help them reduce the stigma associated with the condition. Also promote inclusivity. So when we're talking about that, acceptance, encouraging, being definitely included in school, workplace and communities, which creates a more diverse society. And then we're looking at improving mental health, which feeling accepted improves mental health wellness and well-being, and also reduces anxiety and depression. When we're talking about promotes positive change, So, autism acceptance encourage society to celebrate the diversity of human experiences. It recognizes that every individual, regardless of neurotype, has a unique strength and contributes to everything they offer. They enrich basically our collective human experience. So we want to definitely build that awareness there. So when we're talking about coaching, we're talking about advocates for adults. So people on the spectrum may have difficulties with some of the executive functioning. They may also have some concerns with um, coping with sensory assault, and then also looking at connecting socially. And then we're talking about understanding and responding appropriately to social cues, setting goals, maintaining motivation, and managing the challenges of independent living. Some of the tools that can be considered when we're looking at an individual that's kind of growing into their adult years is tools that can be used to help assess for later in life. The Life Map, which is the life management assistant program. That one will have the clients to be able to improve their quality of life, increase their independence, and progress towards reaching their full potential. And then also you have the GRASP, which is Global and Regional Asperger Syndrome Partnership, which provides support for adults and their parents. Um, Moving right along here, just looking at the fact that coaches, advocates, and awareness specialists, basically, many of them may work with or for the family, but they also might be a psychologist, a social worker, a therapist, and they may help the parents to manage their feelings about parenting a child with autism or an adult with autism, being on the autism spectrum. And then also, this is especially needed for if the individual that have autism have particular disruptive or they're difficult to manage those behaviors they may have. If they're having difficulties with time connecting and the communication, things like that, a lot of times that would, when if they're definitely struggling, then that would be where a coach, an advocate, or awareness specialist will be able to come in and definitely support that family, even helping them navigate services that may be more beneficial or more helpful when we get into those difficult times of the, connecting and the communicating, and then those behaviors coming out as well. So when we're thinking about the experience and knowledge in the field of special needs, we have to look at the fact that a lot of our special education teachers, they definitely are ones that um, are definitely able to work with our individuals and assist in IEP meetings. You can also have an advocate that help you with the IEP meeting. That's one of the things that we do at Green McElwain Foundation. We try to make sure that we can help the parents advocate and maneuver through those meetings more appropriately and with more understanding for themselves. Having the in-depth knowledge of the transition process is another place where coaches, advocates, and awareness specialists can come in to assist, helping the parents understand, should the person, should the parent work, how and why the parent should be working with the school to create a transition plan for the child as they get older and is about to transition out of school into adulthood. So that's always a good thing as well. And being helpful in that plan would be good to have a coach or an advocate or awareness specialist involved. All right. So moving right along, we're talking about exploring housing options. That's another one to think about as individuals start to become adults. They start thinking about where they want to live. So a lot of times a specialist or coach or an awareness individual advocate person can also explain some of the federal and state voucher systems, and they can help vet out some of these group homes that might be available or other independent living options for individuals. And then when we look at the special needs law expert, That's a lot of our attorneys for the most part can be helpful. They can be helpful in a way of guiding parents through the complex decisions surrounding guardianship, health proxies, power of attorney, special needs trust, life insurance, and will. So a lot of good stuff in there that can be helped to assist the families with. Provide a support that is needed when they're making serious decisions, serious and tough decisions that they have to make for the adult child, or adult individual with autism. And then signs and symptoms for the autism spectrum disorder. So I wanted to kind of put these in here because signs and symptoms is something that comes along with being younger, or being maybe even school age, and then start to happen. And start to realize that something has gone on. So basically, autism spectrum disorder is a developmental disability caused by the difference in the brain. Individuals with ASD often have problems with social communication and interaction, and restricted or repetitive behaviors or interests. They may also have different ways of learning, moving, or paying attention. It is important to note that some people with ISD might also, oh, some people without ASD might also have some of these symptoms. So some of these things can be going on, and a person may not be diagnosed with ASD. So understanding that, but for the most part, when we look at people with ASD, their characteristics can make life very challenging. So some of these things can be a lot for them. And then we talk about social communication. So some examples of social communication and social interaction characteristics related to ASD include avoids or does not keep eye contact, does not respond to name by 9 months of age, does not show facial expressions, happy, sad, angry, and even surprised by 9 months of age, and then does not play simple interactive games like patty cake, or by 12 months of age, and then using different I'm sorry, using um, few or no gestures at all by 12 months of age. So basically, they don't wave goodbye. They don't really give any gestures at all by 12 months. Other social communication things we have to look forward to: does not share interests with others by 15 months. Example, showing you an object they like. Does not point to show you something interesting by age 18 months. Does not notice when others are hurt or upset by 24 months. Does not notice other children and join them in play by 36 and does not pretend to be and does not pretend to be something else, like a teacher, a superhero, or some of the things the kids play when they're younger, doing by the age 48 months. So yeah, it's a lot there. Does not sing, dance, or act like you by 60 months. So again, a lot of this is stuff that people see. People may have different developmental scales. Like some of these things, I can say definitely my son with autism was doing things like this. Like he was definitely mimicking me. And he was probably about 1 years old, 2 years old, mimicking me vacuuming the floor, and he had the vacuum, pushing the vacuum. He was afraid of it. Had the vacuum, and he had the remote control up to his ear as if it was the phone. And it's like he was just talking and talking. And then he would sit on his little in his little chair, and he had this little steering wheel, and he would be driving, and he'd be like, "Get out of the way!" And he was saying that because that's what his dad says in the car sometimes: "Get out of the way," or whatever. So some of those things are things that can show up, or and again, that doesn't say that my son is not autistic because he did that. He actually did go through a battery of testing that showed that some of those things were impactful enough that even though he did certain things, and like I said, he didn't have any major milestone issues, walked at about 8 or 9 months and, was moving and doing everything. And then all of a sudden, about 2 or 3 years old, things started looking totally different. So, um, moving right along here, talking about restriction or repetitive behaviors or interests. So examples of those would be lining the toys up or lining objects up, getting upset when the orders change, repeats words or phrases over and over, and then also plays with toys the same way every time, and focus on parts of objects. For example, the wheels on a car versus the whole car. Um, Other behaviors to think about is getting upset um, by minor changes. So when something changes, just getting really upset, having a tantrum, has obsessive interest, must follow certain routines, flapping arms, rocks body, or spins self in circle, has unusual reaction to the way things uh, sound, smell, taste, look, or feel. So all those are involved as well. Other characteristics we can look for. So some of the other characteristics would be the delay in language skill, delay in movement skill, delay in cognitive and learning skills, also hyperactive, impulsive, or inattentive behavior, and then epilepsy or seizures. Other characteristics to think about is unusual eating habits, sleeping habits. Yeah, some gastrointestinal issues could come up as well. Unusual mood or emotional reactions, anxiety, stress, or excessive worry, and then of or lack of fear or more fear than expected. So diagnosing individual with ASD, so diagnosis of ASD would be complex symptoms. So testing in areas of specialty. So there'll be different areas of specialty that they will be definitely testing in, observation of the child and asking how your child socially interacts, communication skills, behavior with developing and changing things, changing over time. So definitely want to look at the child getting tested, testing covering all the areas it will cover would be hearing, speech, language, developmental level, social and behavioral issues, present structural, social and communication interaction with your child, and score the performance. And then they will also use the DSM 5 to basically look at the diagnosis, giving the child the actual diagnosis, giving the individual the actual diagnosis. Um, so moving right along, more with diagnosing. Sometimes it does include specialties to determine the diagnosis also. And then a lot of times, some of the recommended genetic testing to identify where the child has a genetic disorder. And the child may have a genetic disorder like Rett disorder or Fragile X syndrome. Rett syndrome or Fragile X syndrome. And then when we're looking at treatments for ASD, so there's no cure for autism. We've already talked about that. So being on the autism spectrum disorder, there is no cure, and there is no one size fits all treatment for an individual. I really think that an eclectic approach to treatment works a lot better because you get to try to figure out kind of different things that will work, and then go, do away with the things that are not working. So you stick with the things that are working for the person, and then the things that are not working, kind of put those aside. And then you never know, they can also develop into those things a little bit later. They might not just be ready at that level yet to really do the next thing. So you can just move it aside for a while and just continue to work with the individual. So the goal of treatment is to maximize a child's ability to function by reducing the autism spectrum disorder symptoms and supporting development and learning. So early intervention during the preschool years can help, so your child can learn critical social skills, communication, functional, and behavior skills. And then when we look at treatment or options, we can look at behavior and communication therapies. A lot of those programs talk in the range, are in the range of social language behavior difficulties. Um, and then also we look at educational therapies. Individuals getting that would be basically the highly structured educational programs. And then when we're looking at family therapies, parents and other family members who can help to play and interact with the child. It helps to promote social interaction skills, managing problems, problem behaviors, and teaching daily living skills and communications. All right. Other therapies, depending on the child's need, speech therapy, and to actually improve the communication skills, occupational therapy to teach activities of daily living, and then physical therapy to improve movement and balance may be beneficial. Medication, no medications can improve the core signs of autism, but there are specific medications that can help control certain symptoms. Like they might give you something if the child is hyperactive or inattentive or whatever. They might give you, Adderall, or give you some type of medication to kind of help them to be more focused or help them to sit down in class so they can focus a little bit better. Um, but again, those are things that come along with the fact that there is a diagnosis. And then managing other medical and mental health conditions. A lot of time, medical issues, children with children with autism typically sometimes will end up having epilepsy, sleep disorder, limited food preference, might end up having some stomach problems and things of that nature. Those are some things that come along with it. But I'm sure there are probably many others that come along with it as well that's not listed here. So I just don't want to say that's the only thing that comes along with individual that's diagnosed with autism. So when we're looking at problems with transition to adulthood, so teens and young adults with autism that's on the autism spectrum, a lot of times we have difficulty understanding the body changes. So that's something to be mindful of and talk about and aware of and educating and making that awareness of it. Other mental disorders, teens and adults with autism spectrum disorder may often have mental health issues such as anxiety and depression. Could be some other stuff to go along with that, but these are just a few that we mentioned here. All right. So as far as our resources, we got our information from the CDC. We got our information from definitely Childhood Development Center, Mayo Clinic, and all that good stuff. But with everything that we've mentioned in here, I just want to say that this is an overview of basically autism coaching, autism advocating, and then also building the awareness of autism. These are all in that area. And like I said, I wanted to put it out there because again, Green McElwain Foundation is one of those agencies that we've created in order to work with families that are in these scenarios, in these situations. So I wanted to put a video out there just so that people definitely working in that area would know, people that are parents to children in that area also would be, or parents to young adults or parents to adult children, that they would have some background knowledge, not only just the knowledge, but they would also be able to feel a little bit more secure with the fact that they can get some specialists or some coaches or advocates in place, and things that they should be aware of that these individuals should be able to do for them. I know in my agency, we would go far beyond a lot of the things that we mentioned in here, but that would be something we would talk to each family on, case by case scenario to see whatever we're able to do for those families. So again, just wanted to put this information out here. This is a supervision video. This is a video just to get the information and understand what's going on around in the world of autism. And I thank you so much. Again, this is Dr. Latasha McElwain, and I hope you have an amazing day.